Good afternoon. This is Michele Spatz, and I am very excited to welcome you to our sixth discussion. This is the discussion on conducting the consumer health reference interview. And just a little bit first before we get started with that, some basics. This is an international educational program to provide free, short, on-demand consumer health education for library information professionals or staff. If you complete a minimum of the 12 hours, which you have to take beyond an apple a day or one of the other required minimum courses, you can achieve at least level 1 consumer health information specialization, or level 2 if you want to go up to 24 hours, which is possible through this. Videos of the sessions will be available within a day, and I have to apologize, that has not worked out for other sessions. I am having ongoing issues with WebEx and with YouTube. YouTube keeps marking my videos as spam because it's a series of the same thing. So I finally think I've gotten around how I can make sure that people can see that they won't delete them off the server anymore, because that's not a very helpful thing. You will see a URL for this session for you to get credit. It will be on the PowerPoint. It will also be on the YouTube video in the description after it's posted. If you are in Louisiana, because this is a grant, you can have the fee waived to apply for the specialization. So if you're in Louisiana and you know public librarians or anyone else, school librarians, any information professionals, we highly encourage you to spread the word about this project. You have up until March 31st, 2018, if you're in Louisiana, to submit the appropriate documentation to me to be able to get the fee waived. And there's details about all of that on the website that's listed here. This is our project website, and you can learn about all sorts of different things and other courses that are offered by the National Network of Library Medicine. I do have to, well, I don't have to, but I'm very happy to thank the National Network Libraries of Medicine from under the National Institutes of Health for the award from the University of North Texas to be able to provide this educational opportunity to everyone. So I am extremely excited for our speaker today. When I left the Research Institute and moved into hospital librarianship, everyone said I needed to read Michele Spatz's articles and learn from her and learn all about Plaintree and everything else. And I did that as much as possible. So when I was thinking about who to talk about a consumer health reference interview, I could think of no other person other than Michele to be able to do this. So I am going to now stop sharing my screen, and I'm going to provide the power to Michele to start her presentation. And Michele, you should have it now. Okay, hello everyone, and Julie, thank you for that kind introduction. But you can tell by Julia's comments I have been around a long time. I am a health sciences librarian, always have spent my library work within health sciences library, and a good portion of my career I spent as a founding director of a community-based health resource center. I managed this health resource center for 20 years, and I like to think of it as sort of a special public library because we were focused on health and medical information, and we served the public, and we were located within our community. In fact, we were a block from our public library, so we had a good relationship with them. Anyway, it is a pleasure to be here with you today to talk about the health reference interview based upon my experience. And then a little weird factoid, if you will, is that, I know some of you are participating and working on getting your consumer health specialization, and I applaud you for that effort. I actually was on the task force
that work to develop the specialization. So I'm happy that that's something that you're interested in, and I do truly hope that you find it helps you develop the skills that you need to feel really comfortable and prepared to respond to health reference questions. So we're talking about the different forms that health reference questions take from someone who's newly diagnosed. Could be a family member who is coping with a loved one's illness or diagnosis. It could be someone who is really just interested in staying healthy and living a healthy lifestyle. It could be a student who's writing a paper or given a presentation on a health or medical topic. And all of these are different types of health reference questions that we might be presented with, and they do underscore the importance of having or developing some expertise in this subject area. So really simply, what is a health reference interview? It's a conversation between you as a library staff member and your patron with the goal to determine the patron's information need and then take the steps to connect that individual with resources that answer the question or address the issue and that respond to that identified need. So it's really no different in that aspect than any other kind of reference interview. We are going to talk about the following things during our time together. So we'll look at using open versus closed questions, how to approach unfamiliar terms. We'll look at something that I call the talk-back technique, what to do about sharing difficult information. And I think this is an area that, you know, librarians in general sort of fear and loathe. But hopefully we can share a strategy that will help you respond appropriately and professionally in those kinds of situations. And then we'll look at a couple special types of health reference interviews. So our limited English speaking patrons and those who are hearing impaired. So I always like to start with a smile and a hello, and I think that's sort of a very simple thing to state, but it's really important because a smile is that universal hello, and it does connect you to your patron. It invites them in, and it helps them understand that you're willing to help and willing to engage with them. So whether you're behind the reference desk or if you walk through your library with a tablet to connect with individuals, I think just smiling and saying hello is an important first step. And then I would suggest that you try to intentionally ask, what may I help you with today? And when you ask in this manner, it might actually stop someone in their tracks because they're expecting you to ask them, do you want help or do you need help? And when we ask our question that way, sort of the knee-jerk reaction or response is often no. No. Nope. And so when you ask the question, what may I help you with today, you likely won't get an automatic answer, and you communicate again that expectation that you're prepared to help them. So we're going to talk about using open-ended questions, and I would guess that you are very familiar with these, the who, what, where, when, how, and why. Kind of the Sherlock Holmes questions, if you will. And we use these questions for a purpose because they do draw the user out. And they can't be answered with a simple yes or no, so they're not dismissive types of questions. We know that asking these questions can help guide the user to share more information or describe in more detail what they want to know. It helps the patron to explain things in their own words. And then as you listen to the answers, it may guide you to your next question. So we're going to take a quick look at these within the health reference interview context. So the who is the information for? And you're trying to determine is the information for the individual themselves? Is it for someone else? Is it for a health paper or a class assignment? And sometimes what I learned is that people really can't share that information. If it's for them, they don't want to divulge that. So they may say it's for a friend or a family member, and that's fine, but you do want to ask or say something like, okay, in order for us to find appropriate information for your friend, it would be really helpful if you could tell me their gender and their approximate age. And this will help you sort of hone in on aspects of the information that you're going to retrieve once you know the actual question, because there could be a difference in treatment information if it's a child or an adult or even a senior citizen. And if they do say, well, it's for my son or daughter, then you do want to ask, you know, could you please share their age with me? You want to know if they're a toddler or if they're a teenager, basically. And then this question, what is the exact diagnosis? And you really do need to know this information because many medical words sound alike, and you don't want to provide the wrong medical information. So, for example, there is a word in medicine called dysphagia, and dysphagia is difficulty in swallowing. You have another word that is dysphasia, and that means really the loss of ability to speak, and it's oftentimes brain injury after effect. So perhaps I had a stroke and I have dysphagia. I also might have dysphagia. So again, you need to know exactly what it is your patron is asking for. And then this may be a little bit uncomfortable, but if the individual isn't sure or really doesn't know, then it's important that you stop and take a timeout, if you will. And this is where your advocacy skills and your ability to educate as a librarian comes in. And I know from my years of experience that many people don't want to bother their healthcare provider. And most people think of their healthcare provider as their doctor, even though it may actually be a nurse practitioner or a physician assistant or some other healthcare provider, but people tend to lump everyone into that category, and they don't want to bother that individual. So my approach was always to offer as much support as I could to the individual to advocate for themselves and contact that healthcare provider. And if you think about it, you know, if it was a car that needed a repair and they kind of got home and forgot, you know, well, what are they going to fix? They wouldn't hesitate to call the repair shop and ask. And similarly, I think individuals need some coaching that they don't have to bother their healthcare provider, that typically in their healthcare clinic or setting, there's going to be a nurse or a medical assistant whose job it is to answer telephone calls and field those types of questions. And so they can call and ask that individual what the diagnosis is and how to spell it if they're not sure. It's important if you do this that you explain that they will likely need to wait for a call back. It's not very typical for someone to just be put right through to that nurse or medical assistant, and that because patient privacy rules apply, they're likely going to be asked to provide some type of personally identifying information. So they may have to give their birth date, their address, or some other type of information that would be unique to them. And this is very similar, like if they called to find out what their bank balance was. You wouldn't just be given that information. You would have to share some personally identifying information about yourself in order for that question to be answered. So what I am saying in a very long-winded way is that as much as you can, you want to normalize this process of reaching out and contacting their provider for that diagnosis information. And we just covered all that. And then importantly, if you are in doubt, or more specifically, if the patron is in doubt, then I would suggest not to proceed. And I know this is, again, sort of awkward for you if you're in that situation, but you might say something like, I'm really sorry, but this is too important for me to provide you with information and resources on what could be the wrong diagnosis. So then you can ask them if they have the internet or a smartphone, and you can show them Medline Plus, you know, sort of the gold standard, if you will, of medical information websites for the public. And if you're sharing that information, I would write the web address down, medlineplus.gov, and give it to the patron. And you can also offer to have them call or contact you once they know, and you'd be happy to tell them you'd be happy to assist them. Okay, the where. Where have you looked already? And asking this is something you probably do often in other types of reference questions, but it will help you identify or narrow in on your own starting point if you know where the individual has already looked. And you may also want to double check some of their resources or sources of information. If you sort of sense that the individual search skills aren't as, perhaps as well developed as your own, maybe you've been to a site and you know they have information on that particular topic, but apparently the patron missed it. And then another question is, where are you receiving your care? And you want to fold this into context, if you will, if you ask this. So you might say, do you mind if I ask where you're receiving your care? If I know this, I might be able to connect you with resources that that particular organization provides. So maybe they're offering classes or support groups on a particular diagnosis or condition that you can connect that individual to. And then the when, you know, when are you having the test done, or the procedure, the surgery, when's your next appointment? And we're asking the when question because we're trying to establish a timeline for the individual's next step, so we know how urgent their information request is. They may have an appointment tomorrow, and so it's really important that we are as successful as possible today in our information retrieval. Or maybe their next test is a month, and so that sense of urgency is not as pronounced as if something's coming up tomorrow. You also may need to call on other resources, such as a consumer health librarian at the National Network of Libraries of Medicine, or a hospital or medical librarian within your community to help you find relevant information, depending on, what the question is. And in fact, if your request is too complex, I always encourage you to reach out to your regional medical library. And I'm not sure, but I would suspect that you've discussed this in your class already, but here's the map, and the web address is right in the middle there. And you can look up your state and find out what region you're in, and then how to contact the staff there for additional assistance. And then the how much information do you want? One thing that's really important to keep in mind is that most people who have received a new diagnosis are easily overwhelmed. And so be careful about this. We can have a tendency as librarians to sort of offer everything in the kitchen sink, if you will. And that can be overwhelming because there are a lot of things in addition to that diagnosis that the individual is dealing with. So some of the social aspects, if you will, of that particular condition, like how am I going to pay for this, or will I be able to keep working, or how do I tell my loved ones about this. So my own approach is to provide initial information with lots of reassurance that there's always more information, and I will be available to help them when they're ready. They may be able to tell you exactly how, I just want a little bit, or I want everything. And even if they want everything, you're going to want to be a little more, not everything, I guess, in your answer, because they will be overwhelmed. And you really want them to be able to absorb the information that you're sharing with them, and then to build off that. So you're kind of building a foundation and then working from that, if you will. Another question, a how question, is how do you want the information? So are they okay with website information? Do they want books? Do they want audio or video information? And the response to that question might clue you into their literacy level, and that will be helpful for you then as you retrieve resources for them. And then the why do you need this information? And if you ask this in the first question, who is the information for, you won't need to ask this again. But I just thought I would put it in there. Sometimes we don't make it through all the W and the H's. And then once you sort of feel like you have an understanding of what the reference request is, we can refine what we learned by using closed questions. So these are the ones, as you know, that people respond with yes or no. And again, they help you sort of narrow the focus of your reference interview. And they also help you wrap things up by confirming that you understand either their question or whether or not the information that you've shared with them is meeting their information need. So some quick examples, and I know you're familiar with these. Is this what you're looking for? Does this meet your needs? And here's a different one. Well, you need treatment information. So maybe they told you about a diagnosis, and your sense is that perhaps they want coping information, but maybe you want to know if they also need treatment information. And an important technique is always to do something that I call a talkback technique to verify your understanding. This has different names. It might be parroting, but you're really paraphrasing what you've heard the individual express in terms of their information need, and you're refining then as necessary until you have confirmation from your patron that you do understand their question. So you might say, I understand you are interested in finding out how relapsing polychondritis is diagnosed. Is that correct? Or did I get that right? And again, when you talk back to verify, you want to phrase this so that the onus of understanding and getting it right is on you. You don't want the patron to feel like they haven't explained it correctly. So you're asking, did I get that right? So as you begin your search, you want to look up any acronyms. Sometimes people will come in with a piece of paper, and it might be from their healthcare provider or from things that they've looked up. But if they, medicine is fraught with acronyms, so make sure that you look them up and make sure that that particular acronym has one meaning. And if it has more than one meaning, sometimes it will be obvious from the other information about the diagnosis which acronym that is. But again, if it's not, you'll want to refer that back again to the healthcare provider. And then for your own self, you'll want to define unfamiliar terms. So if the diagnosis is relapsing polychondritis and it's something that you're not familiar with, you'll want to look that up so that you have an idea of what the subject is that you're trying to investigate. An easy place to look up unfamiliar terms is, again, Medline Plus. MedlinePlus.gov, and in the lower left-hand corner, like their navigation menu is down the left-hand side of their screen, and on the bottom of that menu is a medical dictionary. So it's a real quick and easy place to look up these unfamiliar terms or words. And then verify your spelling. So just make sure, again, you have the whole words that are similar, but they're spelled differently, so make sure you have the correct spelling as you begin your research so you're getting the right information. And then I always recommend that you teach as you search, so you kind of speak out loud and share your search strategy with the patron and the resources that you've selected. So by doing this, my own thought is that, my goal is to empower individuals so they know where to look for this information. And if they have questions in the future, they might think to use those resources and see if they can answer those questions for themselves. And then know where to look. And medicine is a science. It's really evidence-based, and so we want to look at sites that are really grounded in evidence, not so much the ads and the flashy images kinds of things. So these are just a list of some trusted websites. I've spoken a lot about Medline Plus, and I have always called it the gold standard because it has a lot of information. It has easy-to-read materials. It has materials in other languages, a wide breadth and depth of diagnoses and conditions. All of this is in consumer or lay language. They also have information on prescription and over-the-counter drugs, herbs and supplements, and that piece is really great. So, if someone is interested in an herb and you look it up in Medline Plus, it will sort of grade how effective the use of that herb is. So the information there again is evidence-based. Kids Health, if you're not familiar with it, this is a private foundation website that is committed to children's health. The information there sort of has three legs, if you will. The first one is written for kids in language and images for children. Then it has health information for teens that is teen-friendly, and then it has a section for parents. So it's really got a great perspective, if you will, for health information. Lab Tests Online is a American Association for Clinical Chemistry. And let's say you're going in for your A1C3 and you want to know what that test is, what it measures, how to know if your results are in a normal range or not. That's a really great site for that kind of stuff. These next few are sort of self-explanatory. Genetics Home Reference is genetic information on genetic conditions and illnesses, diseases in lay language. Cancer information, National Cancer Institute, really good. Family Doctor is the American Academy of Family Physicians website for patients. And they've gotten a little bit addy in the last few years, but the information itself is very easy for individuals to understand. Centers for Disease Control and Prevention, not one that people often think of, but they have some really great information there, and they're really adept at writing these things in plain language. And then last one I want to highlight is HealthReach, which is a relatively new site. I'm going to say was probably launched within the last 6 to 8 months. And it is health information in many languages. So I can go in there and let's say I put in asthma, and then I can see what kinds of information on asthma are available in Chinese, Spanish, Portuguese, any other languages. For each topic or diagnosis, they may only have 1 or 2 languages that provide information on that topic, or they might have as many as 8 or 10 different languages. So they're still building that site out, but it's really great to know about. And then I do want to say a thing about books. I kind of, again, medicine is evidence-based. We want information that's really current and up-to-date. So I'm always a little hesitant about going heavy on book information. So I think of health books basically as things that might be good for coping information or living with information, or maybe to give kind of a high-level overview of a topic. But I would be very aware of the date of that information, and I wouldn't want anything older than 3 years. In the way that the exchange of information in publishing of research has accelerated, even that to me is starting to feel a little bit on the fringe side of currency. So explain limitations, and by that I mean explain your limitations as a librarian. You want to encourage your patrons to discuss anything that they find or get in the library with their healthcare provider. And so, in doing that, this sort of underscores why it's really important that you use evidence-based resources. If your patron is talking to their healthcare provider and they're mentioning a source from, let's say, the Centers for Disease Control that you shared with them, it's going to have a lot more weight, if you will, than just a Google search, let's say. And then it's important for you to know and to be able to share with patrons that the information that you provide for them may not apply to the individual's unique clinical picture. And really, that's why you're encouraging that conversation with their healthcare provider, because only that individual can really understand the individual's full health history, their test results and so forth, and know how that information may or may not apply to them. So the information you're sharing is sort of the textbook example and maybe sort of general, but it may not be specific to your particular patron. And then always share that you're not a healthcare provider. And I know, I think you have had or you will have a class on the ethics of health reference interview or providing consumer health information. And so you don't diagnose, you don't recommend treatments, you don't tell people to go to one provider over another. And my personal pet peeve is you don't share your own experience in the healthcare system or that of a loved one with your patron. So keep it professional, and all will be well. And then sometimes when you are doing your search for information, you find that the condition or diagnosis may have a poor outcome. And the dilemma here is you may not know whether the patron is aware of this or not, and so what do you do? And the first thing you want to do is maintain your own composure and professionalism. Sorry about that. And then you want to ask whether or not the physician has explained the diagnosis. You might find that, yes, they have explained the diagnosis. And if the answer is yes, then go ahead and proceed with your reference interview or your research and with sharing the information that you've found. And then you may want to offer comfort measures. And this can be something as simple as just a quiet space for the individual to review the information. In our resource center, we had tissue boxes sort of strategically placed, if you will. So, you know, people needed those, they were available. Sometimes, depending on your particular library environment, you may be able to offer a glass of water or a cup of tea or some other type of comfort measure. And then sometimes you ask if their healthcare provider has explained this to the individual, and they say no. And again, it's really important to maintain your composure and your professionalism. And you're going to prepare the individual to receive the difficult information. So you are going to share this information with the individual. That is part of your professional responsibility. But you sort of pave the way, if you will, and prepare the individual to learn something that they might not be prepared for. So you can say something that, you know, I'm concerned about the nature of the information, and you know, I'm concerned that you may find this information distressing. And then you're going to want to encourage them to talk with their provider about this. We mentioned earlier about how they are a unique individual, and the information there is a textbook case, and so it may or may not apply to their particular situation. And then again, emphasizing that their healthcare provider does understand their complete medical history and will be able to explain whether or not the information is truly relevant to them. And then you go ahead and, share what you found. And again, be prepared, if you can, to offer some type of comfort measure. And you may, that may be listening. They may need to sort of decompress a little bit and want to talk about it. You can, again, offer a private area or a quiet place if you have one, those kinds of things. And then in both of these situations, it's really important to share local community resources on the diagnosis or the condition. So again, if there is a support group available, that is often very helpful to individuals to have that information, and they may find comfort in knowing there are others who are dealing with this same type of issue. And if you don't know where these are, feel free, if you will, to reach out to your area hospitals, healthcare organizations, and ask them what kinds of support groups they offer. It might be available right on their website. It usually is. Just so you know what is out there to support your patrons. Okay, so let's look at handling the health reference interview with individuals who have limited English proficiency. And this does add a layer of complexity to the health reference interview because we all want to be understood and we want culturally relevant information in language we can understand. And there is still a lot of work to be done, in my opinion, in this aspect of consumer health reference, but it is getting better. And I've always found that sensitivity and sort of that smile or universal user-friendly approach will help if you don't have culturally diverse or multilingual librarians on your staff. So here are some tips in that situation. So speak slowly. Limited English proficiency individuals who are learning English cannot track fast talk, if you will. So speak slowly and use short, simple sentences. Make sure that you enunciate clearly and use proper English. So don't use jargon or acronyms or idioms. So, for example, if you say, boy, that's right on target, they're not going to understand that. So it's, do the best you can to speak proper English. And then it's important to face the individual and speak directly to him or to her and understand that culturally the patron may not look at you or speak directly to you, but that's okay. Another thing is to use pictures or illustrations to help communicate. So don't be afraid to draw or also write simple words down. Oftentimes people who cannot understand the spoken word will recognize written words. And oftentimes they learn the written word before they learn how to speak those words very well. So that can be helpful. It's important to be patient and repeat your questions or your statements if necessary. And non-native speakers typically appreciate having having something repeated. And sometimes in that repetition or perhaps rephrasing of your message, it will get conveyed. Another thing you may be doing already is having a language identification list or flashcards available so individuals can identify their native language. And then if you once you can ascertain what the question is, you can work to find resources in that native language. And I put a web link up to those kinds of identification lists or flashcards that you can use in a library setting. And then if you have interpretive services, some of you may be hospital-based, call them, or, in your public library, if you have a staff member who speaks that particular language, you might ask them to step in and assist with that reference request. And then use the universal OK to ascertain understanding. It does seem to be a word that everyone knows and recognizes. And then know where to find quality, again, evidence-based, multilingual and multicultural information. So I mentioned the Health Reach, and then Medline Plus itself has resources in other languages, and there's an organization called the National Institute on Minority Health and Health Disparities, and they also have information in other languages. Okay, so dealing with individuals who are hearing impaired, again, speak slowly and enunciate clearly, and you definitely want to face the individual so he or she can read your lips. And that's also why that enunciation is so important, because they literally will be watching and trying to read their lips. And another thing that you can do is shorten the distance between the two of you, and to stand still as you speak. So if they are trying to read your lips, it isn't difficult if you're kind of, walking as you're talking to them. And then speak loudly, but don't shout. We all have a tendency to ratchet up our voice level, and we want to do that to some respect, but not to the point where it feels like to us and to that individual that we're shouting. And then sometimes we need to find different words to use if the individual doesn't understand us, because some words are easier for them to recognize. And where you can, use plain language or shorter words, so words that are 3 syllables or less might be more helpful. The more syllables our words have, the harder they can be for an individual to read our lips. And then if you can, move the individual away from areas where there's lots of background noise, such as your reference desk, so that you can both actually concentrate on your conversation. And many librarians will do this with any patron. If they find out, the minute it becomes a reference request, we start kind of moving to a more private area if we have such a thing. I did want to talk briefly about HIPAA and health reference. I attended a webinar a week or so ago, and this was a question that came up from some of the public librarians who were participating. And it was, HIPAA, and what do we do about that? HIPAA is the Health Insurance Portability and Accountability Act. It was enacted actually in 1996, and it was designed to protect patient information that was transmitted electronically between what the Act calls covered entities. So health plans, like insurance plans, clearinghouses, and providers. And so, for example, if you have a healthcare visit and your provider then bills your insurance company, they'll be transmitting all kinds of information about you, and that information is protected under HIPAA. So Public libraries are not a covered entity. They're not bound by HIPAA, so that's not something that you need to be worried about. At the same time, we wouldn't be librarians or library staff members if we didn't hold in the highest regard the confidentiality and privacy of our patrons. They're really ethical cornerstones of our service, and so in practicing health reference information, we would not, of course, share that outside the bounds of our professional scope of practice. And then for those of you that are in a health science or medical library, if you're in a hospital or an academic medical center, you are bound by HIPAA. And my guess is you've probably had annual employee training on the aspects of HIPAA and how you must comply with that. So, talking about protecting patron privacy, we still may want to collect health reference data, and we can do that. We simply strip it of any personally identifiable information. And I think we would do that regardless of whether it was health or any other kind of request. But one of the things that I used to have our reference desk staff do is jot down just the subject. So arthritis in the knee, pituitary tumor, Raynaud's disease, whatever it was. Sometimes we would spend some time writing these requests like arthritis in the knee, a senior, pituitary tumor treatment for a child, to really help us kind of hone in on what kinds of questions we were being asked. And then if you review these over time, you can identify trends and see emerging trends for health information. And then that can help you with, boy, we better get up to speed on what websites we're going to try first. If someone comes in asking about this, or websites that we want to recommend. Can help you if you do health programming and also address staff knowledge gaps. So I do think it's a good idea. And then just quickly, some references that the program today was based upon. So these are here if you want a little bit more in-depth information. And then I told Julie I was obligated to do a shameless plug for Rowman and Littlefield in exchange for allowing us to share Chapter 7 from one of the books that they published. I just need to make you aware that for a limited time, you can get 30% off of this particular resource. So there you go. And now, any questions? What questions do you have?
If you can't figure out how to unmute yourself, then you can go ahead and type them in the chat box. We prefer a chat box instead of the question and answer, just because then we don't have to look at two different places. I'm very excited. We have 37 people who are attending today, so this is awesome.
Hey. I'm not sure if you're getting any questions, Julia.
No, I'm thinking they may be typing, so we'll give it a minute or two. And then
okay. Because I was going to share in the absence of questions, I'd love to hear participants' experiences.
One comment, I am a new librarian and this is very helpful. That's very nice. Thank you.
Yes, thank you.
Oh, Michelle, can you back up and show the slide about the book again? We have someone asking about that.
Oh, yes, this one.
Yes.
There is also a link to this on the Go Consumer website under the discussion day. So if you go to the discussion list URL, then you can actually get the ad pull right up and everything.
I feel like an infomercial, only $9.95.
Michelle, we have a question from someone who asks about resources that you might suggest for age-appropriate resources for children who are diagnosed with cancer.
Ooh, yeah, that's a good one. So I would probably try Kids Health to start, and you know, the National Cancer Institute would also be a good place to start. On the Medical Library Association website is a list of current cancer resources. And I looked at it last week, but I'm sorry, I can't remember if they have pediatric resources available. But if this individual wants to email me, I can quickly put together a list and send that out, or I can share it with Julia to share with the group.
I know you can also try St. Jude. Sometimes they have information.
And I'm kind of thinking too, it could depend on the diagnosis. Like a lot of children's cancers are brain tumors, and so the American Brain Tumor Association would be a good one. It may somewhat depend upon what kind of cancer it is.
We have another question. Can you talk a little bit more about handling questions over email, the pros and cons?
Yes, I can. So if you're going to do an email health reference service, you probably want to have like a form that you ask individuals to fill out. What I have found is that because it's relatively anonymous, you may get asked some really, interesting, I guess is a kind word to use, kinds of questions, and you can have things devolve, if you will, into a quagmire. So that's a lot of language to say that, email health reference, it can be fraught with problems. Using a sort of a couple of things, a form that people need to fill out so you get specific information, and then also sort of an explanation, if you will, of the parameters of your e-reference service. So explaining the limitations of your scope, if you will, practice as a librarian. So I'm a librarian, I'm not a healthcare professional. Here are the things that I can do. I can, perform a search for you. I can suggest websites, blah, 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 blah. And then also suggest that, again, they take the information they find and share it with their healthcare provider. So you want to kind of put some sideboards on that service, or you can find that people will overshare information with you, their complete medical history, and you're sort of digging through all of this to find an actual question. So you do want to set it up correctly, if you will, and not to not to sell books, but I know there is actually a form in this Rowman and Littlefield book that is suggested that people sort of use or adapt for that kind of service. Did that answer your question?
They have not responded back with chat, but let's see here. There's another question. Someone would like to know your thoughts on guidance on embedded library work or making RAMs on inpatient units in a specialized children's hospital with a consumer health library.
Oh, love it, love it, love it, love it. So Yeah, you really have to have dedicated staff for that, in my opinion. Or at a minimum, it's a half-time position, you know, for someone to be doing that. If you're, and I love it because it takes the information to where it's needed most, which is the bedside. If you're a parent dealing with a sick child, you may not want to leave and go and find a library to, you know, get information or resources on your child's condition. So it's a really value-added service, in my opinion, to the patient, and it can be extremely helpful to families trying to cope in that particular environment. If you're going to start a service such as this, I would suggest that you do what I call start small and then build upon that. So maybe take a particular unit and roll it out and see how it goes. You'll need the buy-in from the nursing staff, from the medical staff, from the leadership, nursing supervisor, charge nurse, whoever it is on that particular unit, in order to make that service successful. And we actually, when I was Resource Center Director, we had an embedded librarian program. And what we found is that the nurses don't have time to do that kind of in-depth deep dive for health reference information that we as information professionals are trained to do. So it can be a help to them as well.
If I could add some comments in on this one, since I used to round, and when I went to my hospital, I would actually go to the unit managers, and one of them was the pediatrics unit, and I would go like twice to 3 times a week. Some units I went every day, depending on the turnover. And I would just say, do you have an unusual case that's happened that you think I might need to provide some information for? I tried to develop an actual on-demand kind of thing. Well, we did have an on-demand thing. We did about 80 a month, where someone would call us and say, I need information on X. And I would actually chart that. When I brought the information up, I would write in the chart that this information was provided, and then I would tell them that they should follow up information with their nurse, and I always gave the nurse a copy of the information. So you can do it without having to be present all the time, but like Michele said, you really have to work on making connections with unit managers and then with the nurses themselves. When they find out that they can go in and do follow-up and really get to their really important questions instead of having to explain the general stuff, that makes a huge difference in how they can do their patient care.
And I don't want to get off too far in the weeds on this, because I know we're primarily talking to public librarians, but you know, there are obviously different models for embedded programs. One thing I want to say in support of rounding on every patient if possible is that we often found that there were patients who wanted to ask questions that they didn't want their doctor to know they were asking. So, you know, and they didn't necessarily have a, you know, a unique, if you will, a diagnosis. So it was important just to make that connection so they had that opportunity to ask things that wouldn't really have gotten asked if we hadn't stopped in and talked with them. So anyway, thanks for the question.
Michele, we have another question. Someone who's had a hard time finding information with images. They tried Medline Plus, but says it hasn't really helped them. Do you have any go-to sources for images with the information that you provide?
Well, I wish I could say I do. I would try the Centers for Disease Control and Prevention. You have hit upon another area that needs development, and I'll just sort of share a project that I'm working on right now. I'm working under a grant to promote health literacy, and we're actually building an open source database of patient education materials that are largely pictorial. because we do see a void in this area. So that's something that is coming, and I've actually had conversations with the National Library of Medicine about this and the need for this, but it really is difficult. I would say on the Medline Plus website, perhaps the best place there would be the medical encyclopedia. So if you haven't tried that, I would give that a try. And then I would also try the Centers for Disease Control and Prevention. That's a great question, and I'm glad you brought that forward.
I did put in the chat box the MLA Cancer Resources for Special Populations, the caregiver link, and the pediatric population link. And what I will do is, and I think it might have distorted that last one, I will also put these on the discussion list on the GeauxConsumer. I try to follow up with any information that's provided during the session. I put that on the GeauxConsumer website under the discussion listing.
Mm-hmm.
Someone also recommended cancer.net resources, and I think that's out of Philadelphia.
Mm-hmm.
And I think that's a fairly good resource because obviously they've done like some of the major cancer children's research.
Mm-hmm.
It's where all the leukemia research started. So,
Michele, one other question someone had was regarding procedures where the person coming in has been told by the doctor, I need you to decide if you're going to do, if you want this or that procedure. I know you mentioned lab tests, which will give them some stuff, but do you think of any other particular thing that might give them more information on the procedures themselves for them to decide, I want to do this versus that sort of thing?
Yeah, you know, again, Medline Plus, but there are more specific sites, so it would be, you know, like the American Radiological Society. So you kind of want to think about it. Is it an X-ray? What's the professional organization for that group? They all, you know, that professional group, they'll have a website, and they often have patient information. You know, it could be the American Academy of Orthopedic Surgeons, so they're going to talk about knee replacement, hip replacement, and the different kinds of procedures for those operations. The American Association of Cardiology for different heart procedures and information. So you're going to sort of need to develop a bucket list, if you will, of these kinds of tools that you can turn to, but you're going to get better information if you go to that specific association. Then, for example, you can try Medline Plus, and hopefully it would lead you there, but it may be a little bit too general for that. And also, I don't mean to sort of slam them, but they just uploaded a lab test page on Medline Plus, and I still would recommend lab tests online. It's a lot more specific and gets you quickly to what the patron would want to know.
Also, if you're on Medline Plus and you're not familiar with it, this is for the people that are not familiar with it, go all the way to the bottom. It typically will list associated organizations, or you know, I can't remember what the terminology they use, but it's always down towards the bottom, and you can go directly from Medline Plus to probably the groups that you will have that will have some of that information.
Mm-hmm.
All right. Well, we've gone over a little bit today, and so I'm going to go ahead and there haven't been any other questions that I've seen, and so I'm going to go ahead and thank Michele for coming and for talking with us. I'm just going to give a real quick blurb about our, if I can get my machine to work, our next speaker. So our next speaker, I'm very, very, very excited to say is going to be Linda M. Harris. Dr. Harris, she is the Director of the Division of Human Health Communication and eHealth at the Office of Disease Prevention and Health Promotion. with the Department of Health and Human Services. I'm so very excited. She will be talking about evaluating websites and some of the information that they have developed at the Office of Disease Prevention and Health Promotion on evaluating and things that they're recommending that health websites have. So this is going to be very good. The article is posted up there that everyone should pre-read, so that's there. Also, just the general URL. Here is the URL for the assessment, and I will be putting this URL in the chat box as soon as I stop sharing these slides. And here's my contact information if anybody has any questions. Everything is active as far as I think this is the first time we've had everything go perfectly. So I'm hoping that it holds true. And I will provide some of the links that were listed under the discussion groups with the Go Consumer. And once again, I want to thank Michele. And if you want to stick around for the URL in the chat box, please do. I'm going to stop sharing, and I appreciate everyone who attended and stayed for so long. And I'm going to post the URL in the web chat box right now for the assessment. And once again, thank you, everyone.